Welcome to Cumberland Conversations. I'm Sally Shutt, Cumberland County's Public Information Director. This month, our conversation concerns the Department of Social Services and how it is working to support state and federal mandates affecting programs that serve thousands of Cumberland County residents. We will be focusing on a federal and state initiative called Work Support Strategies. Heather Skeens, the Deputy Director for Cumberland County Department of Social Services, and Vivian, the Section Chief for Economic Services at DSS, are here to explain how this initiative is being implemented on the local level. Ladies, thank you for being here today. Ms. Tooks, what is the Economic Services section?
The Economic Services section is primarily responsible for our benefit programs. These services are food and nutrition services, child care services, adult Medicaid, family and children Medicaid, and Work First, and the TANF program. TANF, the acronym, is Temporary Assistance for Needy Families. We also manage our energy programs. The energy programs that we manage are the SIP program, and that the acronym is a Crisis Intervention Program, and our LEAP program, our Low Income Energy Assistance Program. These programs, energy programs, are administered through the Salvation Army, located at 1047 Southern Avenue.
Ms. Skeens, what is Work Support Strategies?
Work Support Strategies is an initiative that really began back in 2011 with the Division of Social Services at the state level. And what happened was the division created a plan to look at a new holistic way of economic services service delivery. And so they applied for funding through the federal government for a year planning opportunity, which was successfully funded. And so they spent the next year creating the Work Support Strategy Action Plan. Once they created that plan, they then resubmitted the plan for additional fundings in order to implement the steps and the goals of that Work Support Strategy plan. And really it is focused on customer service, so it's a customer-centered plan, data-driven, and it uses technology and automation in order to enhance a customer's experience through streamlined processes.
Ms. Tooks, well, what does DSS hope to accomplish through Work Support Strategies?
With Work Support Strategy, we hope to accomplish many goals or tenets. One of these is that our customers, we want them to be served so they can tell their story one time. One of the things that we've done to accomplish this is develop the universal worker concept. The universal worker are individuals, caseworkers within our agency that are able to be knowledgeable in all 5 of our programs. So if a customer comes in, for example, if I wanted to apply for food and nutrition services and Medicaid, I would tell my story once with the universal worker, being able to tell her what I need and not having to tell my story over and over again. Another goal of our Work Support Strategy is no wrong door concept. And no wrong door concept simply means that our customers have choices. They can choose when, where, and how they apply and access services. An example of this is our new program called ePass. You've probably heard a lot about ePass, and that stands for Electronic Pre-Assessment Screening Service. And it's a wonderful service in that our families can come in and apply for assistance through our Resource Center at Department of Social Services, or they can choose to stay at home and apply through ePass online. They can access ePass at home, at our local library, at our resource centers within the community, and again at our resource center. We have many families that are working right now, and taking off work is a hardship. With ePass, they can apply at home and submit their application. We have those who may decide to come into the agency. They can come into the agency and not have to wait many, many hours to see a worker, but they can come in and go to our resource center and apply for benefits there. And if they need assistance with the computer, then the caseworker will assist them. This keeps our families being able to make choices and not to be hindered in applying for services.
Now, over the last year, the North Carolina Department of Health and Human Services has introduced a new electronic system. And so, Ms. Skeens, can you tell us about that system?
Sure. The electronic system actually began back in 2009, and it's called NC FAST, which stands for North Carolina Families Accessing Services Through Technology. And it has been in its infancy stages over the last couple of years with a plan to implement in 7 stages. With Affordable Care Act coming into play, it has required that implementation schedule to be increased so that NC FAST is working throughout the state prior to Affordable Care Act. And so back last year, the state began to implement across the state food nutrition services through the North Carolina FAST system, NC FAST system. And really what that system is it's part of one of the strategies for work support strategy. It's the electronic or the technology used in order to process eligibility for the Medicaid, Work First, Child Care, Food Nutrition, as an example, eligibility programs. And so it meets one of the requirements for work support strategy in that workers or families are only telling their story one time. And so they're able to use a streamlined application process that allows them to apply for potential benefits that they may be eligible for through one universal worker, and therefore only telling their story one time.
Okay. Now, Ms. Took, as Cumberland County was preparing for NC FAST, tell us about how our local department prepared for this transition.
I can say that initially we had many, many meetings, but in the end, the state required or asked us, all 100 counties, to select an individual that would be our champion, our liaison for work support strategy. Our agency chose Ms. Melinda Seaman. Ms. Seaman is our work support strategy champion. Her role or her goal was to serve as a liaison between the state, our community, and DSS. She has met many people over time through that role, and in the community she has been very active in allowing people to know what work support strategy is all about. We also, in developing our work support strategy, decided that we were not going to do it alone in economic services, that we embraced our entire agency. So therefore we developed a committee, and that committee was comprised of staff from our different departments. And that committee's responsibility was to look at what would be some of the best practices. How could we redesign and develop our plan for work support strategy? As a result of many, many meetings and subcommittees, they were able to help us in designing our structure in economic services. They also assisted us with our resource center and a universal worker. And we are still working together because this is a project that continues, and we meet continually to look at the best strategies for preparing for in this transition.
And Ms. Tooks, some of our citizens may not realize how large the Department of Social Services is. I mean, well, how many employees work there?
I want to say there are over 700, approximately 700 there. In economic services, we have 220 staff.
Thank you. So, Ms. Skeens, how has our local department, managed with this early stage of transitioning to NC FAST?
We began our transition in late 2012 with food nutrition eligibility benefits. And that was the first phase or rollout of NC FAST through the work support strategies. And about January, February of 2013, we began to experience some delays in issuing benefits, mostly because of some system issues going on, also because of training opportunities for staff, having to pull staff off the production line, so to speak, and put them through training. And then, of course, their learning curve. It takes time for staff to learn a completely new system, figure out how to issue those benefits, and get back up to what we would consider 100% capacity. Once we got through that initial phase, we've been at capacity since about July, issuing benefits. We issue about 5,000 benefits each month in terms of recertification and application. So on time, timely benefits occurring up until about July, and that's when the state implemented or included the programming for the next phase, which is Medicaid, into the NC FAST system. And when that was uploaded into NC FAST, it did create or cause some delays after July through about August, where we were not at 100% capacity again. Whenever you upload new information into a program, there's always going to be some system glitches. There's going to be opportunities for you to figure out why it was working the day before and is now no longer working. And it also includes additional training for our staff because there's new program screens now. And so we were at a decreased capacity as we were implementing Medicaid through NC FAST over the months of August and September due to those additional training requirements and learning curve, and again, adding in that new eligibility program. And so we should be up and running at full capacity soon.
Okay. Thank you. That's some great information. We're going to take a pause. We'll be right back. Welcome back. I'm here with Heather Skeens and Vivian Tooks from the Department of Social Services, and we're learning about the Economic Services section and the NC FAST transition there at the department. Ms. Tooks, tell us about how Department of Social Services has been working with community groups during this transition to work support strategies.
One of the things that we always appreciate from our community is that they have been very supportive in providing us with our needs, different needs that we have had. Recently with Work Support Strategy, we want the community to know what is going on at Department of Social Service and in the Economic Independence section. We want them to have an understanding of how our services are being provided to our customers that are coming into the agency. And I think it empowers the individual. The more you know, the more choices that you can make as far as what you need for yourself and your family. We have been, again, very, very given the support needed from the community. What we've done recently in regards to work support strategy is our agency has facilitated 2 information sessions for our community partners. We invited our community partners, local businesses, and other agencies in to tell them just what we're doing and what it means for our customers and how they can access services. Many of them need to refer individuals to our agency, so they were able to listen to a presentation regarding work support strategies and how we have changed. We have also had several agencies to come out and assist us with food. One of the things that we have needed in recent months is assistance with food because of some of the delays with our food and nutrition program. And they have come out and did food drives for us. In fact, the county, as recent as last week, did a food drive. At our DSS department, our local NCSSA, North Carolina Social Service Association, they did a food drive in which we were able to restock pantries at our local pantries in the area. So it's been a very, very good turnout, and we know that we still have some challenges, and anyone that is interested in partnering with DSS to provide food items, give us a call. Give us a call, and we'd be glad to talk with them.
Okay, wonderful. Now, Ms. Skeens, what's on the horizon in the future with NC FAST?
There are lots of things coming up over the next 6 to 8 months. Probably the first impact that we will be seeing is Affordable Care Act, which is commonly called ACA or ACA, and that is the federal requirements for subsidized health insurance. And so North Carolina is participating with the federal facilitated marketplace. As North Carolina is not facilitating the marketplace, it will be going through the federal government and accessing North Carolina information through the NC FAST system. And Affordable Care Act, really are there 4 components to that. 2 of those components the local Department of Social Services determines eligibility for, and the other 2 components are housed or eligibility is determined at the federal level. And so North Carolina will be responsible for assessing individuals for Medicaid and Health Choice, as we currently do. But in order to access the tax credit or the subsidized health insurance, families will have to be assessed for Medicaid Health Choice first. And basically what happens is a family using that no wrong door concept through work support strategies can enter the marketplace either at the local level or at the federal level. That information will be transferred through NC FAST portal to the state, and eligibility will be determined for, again, that Medicaid Health Choice. If a family is not eligible for those 2 programs, then the local Department of Social Services will transmit that information back through NC FAST to the federal facilitated marketplace, where they will then be assessed for additional opportunities for subsidized health insurance. So that's coming up and begins October 1st. After that, we have what's called the MAGI beginning January 1st, 2014. And the MAGI is the Modified Adjustable Gross Income. And that completely changes Medicaid as we know it for Family and Children's Medicaid. Instead of our current eligibility program, it will determine eligibility based on tax methodology. So it will look very different than it does today. And so an additional responsibility our workers will have between October 1st and January 1st is to not only assess families for traditional Medicaid, but also assess families through the MAGI tax methodology beginning January 1st. Once those 2 things occur, we will also be implementing child care through NC FAST as a 3rd phase. And eventually Children's Services or Child Protective Services and Adult Services will be accessed through NC FAST. So we have a lot coming up in the next year.
Now, aren't your caseworkers going to be cross-trained, even though now in the past they've been specialized in economic services or food and nutrition? Now they'll be able to handle all those different areas?
Our caseworkers in economic services will be cross-trained in all of the eligibility programs. Again, those are Medicaid, food and nutrition programs, child care, work first. Any eligibility program they'll be cross-trained in. So what will happen is when a customer comes in to apply for benefits, if they're a new customer, have never applied for benefits before, they will go to a universal worker in our applications department and use a streamlined application to apply for any benefit that they may be eligible for. And that worker will now assess them for all potential benefits instead of applying for food and nutrition and then going to see a Medicaid worker and applying for Medicaid and on down the line depending on what they're applying for.
And then since North Carolina has opted out of the Medicaid reimbursement. Well, does that mean you're expecting more applicants then?
The North Carolina opted out of the expansion of Medicaid in North Carolina and opted out of being a state-facilitated marketplace. We do expect that because in order to access the tax credit and the potential subsidy for health insurance, you do have to apply for and be assessed for Medicaid and Health Choice, that our applications for Medicaid and Health Choice will rise pretty quick, and we're not sure how many applications that will come to, but we know that we are expecting a substantial increase beginning in the next day or two for Medicaid applications.
Well, thank you. This has been really good information on work support strategies. So, Ms. Took, so this is a great time to also ask you about the other programs in economic support services there at DSS.
I mentioned to you earlier, Sally, that we have our SIP, Crisis Intervention Program, and our LEAP, Low Income Assistance Program. Our SIP program is ongoing, but coming very, very soon, we will start taking applications for our Low Income Energy Assistance Program. Initially, when we start taking applications, we will look at those individuals that are 60 and over. For 2 months, they will be able to apply for the LEAP program. I would like to make a plea to the community that our seniors at many times are not able to come out. What we can do is mail applications to them. They can have a representative come out and fill out an application. Very, very simple. We want them to know that this program is available. It's a one-time assistance, and the check goes directly to the utility provider, and this will help in those cold months when we're trying to budget monies and make all the ends meet with looking at our electric costs and whatnot. The latter 2 months, we will take individuals 60 and under, and they will apply. So I will say to our community partners, our churches, different clubs, and those in the community that can be a catalyst to assisting, especially our seniors, and getting them out so that they can apply for benefits. A lot of people will not come out because they think they're not eligible, but they need to, they can call. They can actually call in and ask about income and reserve, and we can help them through that process right at DSS if they want to. As I said before, the Salvation Army actually administered the program at their 1047 Southern Avenue address. But however, we manage the programs at DSS, and we do go out and monitor what's going on. We know that the lines are long. There's been times when people have told me at 2 o'clock in the morning they come out to get in line, and they really don't have to do that because they can get an application and it will be sent to them and it will come back, they mail it back or have someone to bring it back. And what we will do is the application is numbered, so we always look, we sign their name by the application, and when we don't receive them, a lot of times we have to call and say, we gave you an application, we want to make sure you don't miss the deadline, please send it back in, or let us know how we can get it from you. Last year we even put flyers in a lot of our grocery stores. Myself, I'm out in the community, out and about, but to leave flyers at different places. We have done a lot of marketing to try to address the needs of our families. But I say to them, if you don't apply, you will never know whether you're eligible, and there may be some assistance that you can get that can help with you with those utility costs.
Great. Well, I hope the word gets out, and we'll do what we can to reach those citizens. And as our time comes to an end, Ms. Skeens, I just want to let you kind of wrap it up for us. And what is the final message you would like to leave with our citizens about the services at DSS and work support strategies and all the work that's going on there at your department?
Work support strategies and the automation and technology will actually be an incredible opportunity for our citizens once we have streamlined the process and worked through this very difficult transition, but important transition. Customers will be able to sit in the privacy of their home instead of coming down and having to provide their story and any of the concerns that they have to a caseworker. And so they'll be able to do that from the privacy of their own home on their own time, so convenient to them. And so we're real excited about that and really can't wait for that to come to fruition. But really what I would like to leave on is that over the last year, our community has really come out and partnered with our agency in ways that we've not seen in the past, or in the recent past. And we've just been really excited about this opportunity to really make this a community issue and impact our community and not just DSS. So families helping families, which is really the mission and motto of DSS. So we're excited about that. We also have some dedicated, incredible staff that have worked long hours, weekends to get benefits issued for families who have given up their personal lives and have worked countless hours in the last year to make sure that families are getting the benefits they're entitled to and deserved, so that our citizens are not suffering in our county. And so I just want to take a moment to thank our staff for their loyalty and their dedication and their commitment to our citizens of Cumberland County.
Well, ladies, thank you so much for being here today. This was very insightful. To our viewers, thank you for listening in on our conversation. If you have any questions about today's topic, please contact the Department of Social Services at 910-323-1540 or visit the website at dss.co.cumberland.nc.us. You can learn more about what's happening in Cumberland County government by visiting our website or our Facebook page. We hope you've enjoyed this edition of Cumberland Conversations and that you will join us again each month as we discuss important topics affecting our citizens.